Here I'm going to discuss some ocular terminologies that you will have to know for your Step 1 exam, and then after that move on to pathological eye conditions like Amaurosis Fugax, central retinal artery occlusion, as well as macular degeneration, which you will have to again know for your Step 1 exam. And these conditions will continue to show on Step 2 as well as Step 3 exam. So these are very high yield topics. So first, starting with the refraction terminologies. So in order for a patient to have a sharp view of an object, the light from that object has to focus at the back of the eye, which contains the retina. And three factors determines how well the light will focus at the back of the eye. And these three factors include the cornea, the lens, and the length of the eye. In patients with myopia, the length of the eye is too large, as a consequence of which the light will focus at the center of the eye in front of the retina, and so therefore these patients will have blurry vision. In patients with hyperopia, on the other hand, the length of the eye is too small, as a consequence of which now the light will focus at the back of the retina, as a consequence of which again these patients will have blurry vision. So this is an example of hyperopia, and the first one was an example of myopia. And so in order to correct for these conditions, you will have to provide them with refractive glasses. So for patients with myopia, you will have to provide them with concave glasses, which has a minus power. And what these concave glasses do is that they would diverge the light. And so therefore, now that the light will pass through the lens, it will focus at the back of the eye and the retina, so the patient will have a clear vision. In patients with hyperopia, on the other hand, you will have to provide them with convex lenses. So this is an example of convex or plus lens. So this one will converge the light. And so therefore, now the light will focus at the back of the eye or the retina, and again, the patient will have a clear vision. In patients with astigmatism, there is problem with the surface of the cornea, as a consequence of which light will focus in two separate areas. And so the refractive error in these patients has to be corrected with cylindrical lenses. And then in patients with presbyopia, what happens is that there is problem with the accommodation. And so how accommodation works is that as a person focuses on a near object, the ciliary muscles will contract, as a consequence of which there would be less tensions on the zonules that are attached to the lens, and so now the lens can relax and its thickness can increase. So once the thickness of the lens increases, that person is accommodating and is able to focus the light right at the back of the retina while focusing on a near object. And so in patients that have presbyopia, which is a normal aging process, the lens is not elastic enough in order to increase its thickness. And so therefore these patients, as they age, can no longer focus on near objects. So the lens cannot increase its thickness because it's not as elastic as it used to be. And this is a normal process of aging. And so how this refractive error can be corrected is by placing a plus, also known as convex lens, in front of the eye. So now these plus lenses will help increase the plus refractive power of the lens, and again for near objects the patient can focus the light at the back of the retina. And so therefore reading glasses that are sold over the counter are plus lenses that helps elderly patients with reading near objects. So basically for presbyopia as well as hyperopia, a convex or plus lens will be used. On the other hand, in patients with myopia, a minus powered lens or concave lens will be used. And then finally, in patients with astigmatism, cylindrical lenses will be used. Now for your general knowledge, in case you're interested to know how the LASIK refractive surgery works, in patients that have myopia, the surgeon will use the laser in order to carve the cornea in a way that it produces the properties of a concave lens. So by laser surgery, the center of the cornea will be made thin while leaving the periphery a little thicker. And so by these refractive changes, now the cornea and the lens are able to focus the light exactly on the retina. In patients that have hyperopia, on the other hand, what the surgeon does is that will make the periphery of the lens thinner while leaving the center thicker. So by making the periphery thinner while keeping the center thicker, the cornea will develop properties of a plus lens. And so you recall that plus or convex lens are used for the correction of hyperopia, and so again, light will focus exactly on the retina via this refractive surgery procedure. In any case, moving to the next pathologic condition known as Amaurosis Fugax, and what Amaurosis Fugax means is Fugax means fleeting, and then Amaurosis means blindness. So these patients generally present with an abrupt, painless visual loss, that is as if there is a curtain coming over their visual field. So if drawing their visual field like this, if this is how they're seeing through the two eyes, it's as if there is a curtain blocking half of the upper view of one of the eyes. And this condition usually lasts less than 15 minutes, so it will resolve in 10 to 15 minutes. Now, I would like you to note that there are many different conditions that can cause Amaurosis Fugax, but step 1 examiners like to mainly focus on carotid artery disease, which is a common cause of transient monoocular vision loss, also known as Amaurosis Fugax. And so in patients that have severe carotid artery stenosis, as a consequence of which there is hypoperfusion of choroid as well as the retinal arteries, there would be a transient loss of the vision. The next condition is central artery occlusion, which also presents with a painless vision loss, and an important characteristic feature of central retinal artery occlusion is a cherry red macula. So here is an image, fundus photo of the left eye. On the left side we have the optic nerve, and then we have the vessels that are coming out of the optic nerve. At the center we have the macula, which has a high concentration of the neurosensory cells required for high visual acuity. So what happens is that these inner retinal layers are being supplied by the central retinal artery. But then at the center of the macula, the nerve fiber layers are not as thick. So the center of the retina is thinner. And so you would be able to see the underlying tissues, which is the choroid. And the choroid has a different blood supply than the inner layer of the retina, which is shown here at the surface. So once there is a central retinal artery occlusion, you will see white discoloration of the retina. But then at the center, since the retina is thinner, you would still be able to see the blood perfusing the deeper layers. And so that's why these patients present with a cherry red spot of the macula, because the surrounding becomes white while the center remains red. Now, one other important question that I would like to ask you is that in addition to central retinal artery occlusion, can you name 2 other conditions that are associated with the development of cherry red spot macula? And so if you need a clue, these 2 are lysosomal storage disorders. So can you tell me which 2 lysosomal storage disorders presents with cherry red spot? And your answer is Tay-Sachs disease as well as Niemann-Pick. And in case you have difficulty memorizing these 2 disorders, remember cherry red is hyphenated, so is Niemann-Pick and Tay-Sachs. So Tay-Sachs, Niemann-Pick, both of them present with cherry red macular spot. And so an important take-home message is that anytime you hear the word cherry red spot macula on your step 1, step 2, or step 3 exam, the 3 conditions that you should start thinking of is 1. Central retinal artery occlusion, 2. Tay-Sachs disease, or 3. Niemann-Pick. And these 2 are lysosomal storage disorders. The next and final conditions is macular degeneration, which is the leading cause of irreversible blindness in elderly populations. And so basically macular degeneration presents initially with the pathologic deposition of glycolipids, proteins, and cellular debris, and these pathologic deposits are referred to as drusen. And here is an example of all these drusen that has been deposited inside the retina. So again, here we have the optic nerve, we have the optic vessels coming out, at the center we have the macula, and all these white spots are pathologic deposits which are called drusen. Now there are different forms of macular degenerations, and then treatment options that are available for each one of them is different, but you don't really have to know that much detail. For your step 1 exam, an important finding about macular degeneration that you will have to know is a phenomenon called metamorphopsia. So patients with macular degeneration won't see the straight lines lines straight anymore. They see them kind of like wavy. And this condition is referred to as metamorphopsia, where there is a distorted vision in which a grid of straight lines appear wavy. And then there could also be a scotoma. So from macular degeneration, the patient can have like a huge blind spot at the center of their vision. And so here is an example that may show up on your exam. A patient may come to you and complain that lintel of the door as well as the window blinds no longer appear straight. They appear kind of wavy. And then the question is, what test should you order next? And so the answer to that question is the Amsler grid. So here is an example of Amsler grid. And in patients that have macular degeneration, what you will have to do is that ask them to focus on the black spot and then describe what they see in the periphery. So normal patients will say that they see straight lines, but patients with macular degeneration say that they see wavy lines, and then they could also have like a blind spot at the center. So they could say that, for instance, the center is missing. They cannot see the black dot at the center unless they focus on a different area. And so once again, an important findings in patients with macular degeneration is that they will have metamorphopsia once you test their vision with an Amsler grid. And that concludes our discussion of this video.